Okay, so I'm gonna be doing my head to toe assessment today. I'm gonna show you the room before I start so that you can see that I'm not cheating. There's nothing in here that can help me. So I'm gonna show you. Okay. Okay. Okay, I'm gonna put you down and now I will start my video. Okay, so I'm gonna knock. I'm gonna make sure the room is safe. Make sure I'm scanning for safety. Make sure there's nothing that's unsafe in here. Okay, so hi, my name's Bianca. I'm gonna be performing a head-to-toe assessment on you today, if that's okay with you.
Yep.
Okay, and now I'm just gonna do hand hygiene. Okay, and I just need you to verify your name and date of birth.
It's Haley Philweber, 082606.
Okay, perfect. And I'm gonna check your wristband to make sure that info is correct. Okay, perfect. Okay, so do you need to use the bathroom before we start?
No.
No. Okay, and then the side rails are up, the bed is at its lowest position, and the environment appears to be safe, and the call light is within reach. Okay, so I'm gonna be doing the PQRST now. So can you point to the pain? Where you have pain? Okay. And then what were you doing when this pain started?
I was walking my dog and then I fell.
Okay, and on a scale of 0 being the worst pain, no, 0 being the no pain at all, and 10 being the worst pain you've been in, what would you rate your pain?
I would rate like a 5.
Okay, and how does this pain feel? Does it feel like throbbing, dull, or sharp?
I would say sharp.
And does it radiate up or down?
I would say down to my fingers.
Okay, and then do you when did this pain start?
I would say about 2 days ago.
2 days ago. Okay. Okay, so my patient appears to be awake and alert. She appears to act appropriately for the situation, and she is also speaking clearly, making clear sentences, and she appears to have no speech or hearing deficits. Okay, so now I'm going to move on to my neurological assessment. Okay, and I'm going to be asking you for orientation, which is person, place, and time. And so can you repeat your name for me and your date of birth?
It's Haley Philweber, 082606.
Okay, and so my patient is oriented to person. And now, where are you right now?
Georgian Court Hospital.
Okay, and what year are we in?
2025.
Okay, so my patient is oriented to person, place, and time. Okay, so now I'm just gonna have you do a cerebellum evaluation, and I'm gonna have you do rapid hand movements. I'm just gonna have you point to your chin, your nose, and your head, and then you can repeat it again. Okay, perfect. Okay, and now I'm gonna be stating the cranial nerves. Okay, I forgot to ask her the questions in the beginning, but have you had any head injuries in the past?
No.
Any recent dizziness or headaches?
No.
Okay, perfect. Okay, now I'm gonna be stating the cranial nerves. So I'm gonna start with the first one, which is olfactory, which is the sense of smell. Number 2, which is optic, which is your vision. Number 3, which is oculomotor, which is your eye movement. Number 3, which is trochlear, which is also eye movement. Number 5, which is trigeminal, which is your mastication and facial sensation. And then number 6 is abducence, which is eye movement as well. Number 7 is facial, which is facial like movements. And then number 8 is acoustic, which is hearing balance. Number 9 is glossopharyngeal, which is gag reflex and swallowing. Number 10 is 10 is vagus, which is swallowing, speech, and uvularize. Number 11 is spinal accessory, which is shoulders shrug bilaterally, and number 12 is hypoglossal, which is the tongue movement. Okay, so now I'm done with my neurological assessment, and I'm gonna move on to my skin assessment. So have you had any recent excessive skin moisture or excessive dryness?
No.
Have you had any history of any skin diseases?
No.
No? Okay. And then have you noticed any rashes or lesions on your skin?
No.
Okay, perfect. And I'm gonna inspect the skin. Okay, the skin looks clear and it's pink. There's no lesions or no rashes that I can see. And now I'm gonna palpate the skin. Okay, skin is warm to touch, and there appears to be no lesions or rashes. And now I'm gonna do her skin tour. Okay, she is hydrated. Okay, and I'm gonna do her capillary refill. Okay, so she appears to be hydrated, and her capillary refill is good. It goes down within less than 3 seconds. Okay, now I'm gonna move on to the head and face assessment, and I'm gonna be inspecting the scalp and inspecting the face. So the scalp appears to be pink, and there are no lesions, bumps, or any rashes that appear. And you can look up, and there's no lesions or rashes on the face, and the face appears to be symmetrical. The hair is distributed evenly on the scalp, and there appears to be no bumps on the face or lesions. And now I'm gonna palpate. Okay, so I'm gonna start by palpating her scalp. Okay, I feel no lesions or bumps. Okay, now I'm gonna do the face. Okay, and I felt no lesions or bumps, and I see no rashes. And I'm gonna state A, B, C, D, E. I'm gonna state A, which is asymmetry, B for border, C for color, D for diameter, and E for evolving. Okay, and now I'm gonna move on to the eyes and ears assessment. Okay, so have you had any recent hearing loss?
No.
Any recent eye vision changes?
No.
Do you wear contacts or glasses?
I wear glasses.
Okay. And do you use any hearing aids?
None.
None? Okay, perfect. And I'm inspecting the eyebrows and the eyelashes. The eyebrows hair is distributed evenly, they're symmetrical. Eyelashes are distributed evenly on top and bottom. And now I'm gonna take a look at the ear. Okay, ear appears to be moisturized and no excessive dryness and no excessive moisture either. Okay, and now I'm gonna check for eye constriction. Okay, I'm just gonna have you look at my nose, and I'm gonna point a light at your eye. Okay. Okay, perfect. Okay, so the eye appears to be good, constriction is good. I'm gonna be stating perla, which is pupils are equal, round, and reactive to light with accommodation. Okay, and now I'm just gonna be doing the ears, gonna be palpating. So this is the pinna, and this is the tragus. Okay, same thing on the other side. This is the pinna, and this is the tragus. Okay, and like I said, there appears to be no excessive dryness or moisture on the ears. Okay, and now I'm just gonna be checking your sclera and your conjunctiva. Okay, so I'm gonna have you look down. Okay. Okay, perfect. So sclera appears to be white and clear, and then the conjunctiva appears to be pink. Okay, everything looks good. And now we're moving on to our nose, neck, throat, and mouth assessment. Have you had any recent changes in smell? No. Any recent changes in taste?
Mm-mm.
Have you had any soreness or any soreness in the throat?
No.
Have you had any stiffness or limitations in the neck?
No.
No. Okay, perfect. And now I'm just gonna start by inspect the nose and making sure everything is symmetrical. The nose appears to be symmetrical. The septum deviation is within the midline, and everything appears to be good. And now I'm just gonna check the nostrils for patency, and I'm just gonna have you tilt your head a little up, and I'm gonna check with the pen light. Okay, nostrils appear to be patent and pink, and I'm making sure the trachea is within the midline. Okay, trachea is within the midline, and now I'm gonna move on to my cardiac assessment, which is so have you had any recent shortness of breath? No. How many pillows do you sleep with at night?
One.
One. Okay. And okay. So now I'm gonna be inspecting her mid-clavicular line and be going for intercostals, 4 to 5 intercostal spaces down, and I'm gonna be doing her apical pulse. Let's go. Okay, and then okay, and then I would listen for 60 seconds and get my apical pulse. And now I'm gonna also be auscultating for the aortic, pulmonic, herbs, tricuspid, and mitral. I'm gonna be auscultating with the diaphragm of my stethoscope and then with the bell. Okay. Do aortic, pulmonic, herbs, tricuspid, and mitral. Okay, and I'm gonna do the same thing with my bell. Okay, aortic, pulmonic, herbs, tricuspid, and mitral. Okay, and now I'm gonna be listening to your carotid artery as well, and I'm gonna auscultate with the bell of my stethoscope. So when I put the bell of my stethoscope on your carotid artery, I'm just gonna have you take in a deep breath, and then once I remove it, you can take a deep breath out. Okay. Okay, you can take a deep breath out. Okay, and now same thing on the other side. Okay, sounds good. Okay, everything sounds good. And now I will be moving on to my respiratory. Oh, before I move on to my respiratory assessment, I will be also looking at the extremities to make sure there's no pitting edema shown. And I will be also palpating to make sure there's no pitting edema. So I'm gonna look. Okay. I'm gonna look ankle. Okay. So there's no pitting edema shown. Okay. So now I'm gonna move on to my respiratory assessment. And have you had any trouble breathing? Any chest tightness?
None.
No. Any shortness of breath?
No.
None. Okay. And now I'm just gonna have you get up so I can do your lung expansion. Okay, you can turn around. And now you can take in a deep breath and a deep breath. Okay. Okay, lung expansion appears to be equal and symmetrical. And now we'll be listening to her lung sounds. There's 10 in the back and 5 in the front. Okay, I will be listening with the diaphragm of my stethoscope. And you can breathe normally if you want. If you get too dizzy, you breathe normally. Okay, sounds good. Now you can turn around. I'll be starting above the clavicle. Okay, perfect. Okay, now you can have a seat. Okay, and now I will be moving on to my musculoskeletal assessment, and I'm gonna just have you, inspect for posture. Posture appears to be symmetrical, posture is upright. Have you had have you had any trouble doing your activities of the daily living, like for example, brushing your teeth, taking a bath?
No.
No. Okay, and then have you had any stiffness in the joint, back, or muscles?
No.
No? Okay. And okay, that's it for the questions. And now I'm just gonna do I already inspected, made sure everything is symmetrical and her posture is good. So now I'm gonna be doing a strength test, and I'm gonna have you squeeze my hands as hard as you can. Okay, and now put your palms out. Okay, and now don't let me push down. Okay, and then don't let me push up. Okay, and I'm gonna do the same thing on the legs. So don't let me push up. Okay, and don't let me push down. Same thing on the other side. Don't let me push up, and don't let me push down. Okay, and now I'm gonna have you stand up. Okay, and I'm gonna have you walk to the bin, and then you can walk back.
Okay.
Okay, and my patient's gait appears to be perfect. She has no trouble walking. And now you can turn around, and I'm gonna have you touch your toes and check your spine. Okay. Okay, you can get up. There appears to be no kyphosis, no lordosis, or no scoliosis. And now I'm just gonna have you do a little bit of active range of motion. I'm gonna have you flex your arms 3 times. And then I'm gonna have you abduct and adduct your legs. Okay, and the other one as well. Okay, perfect. My patient seems to be doing her active range of motion by herself and has no trouble. Okay, you can sit back down. Okay, and I'm gonna let the patient know that I am done with her head to toe assessment. So I'm done with your head to toe assessment. Do you have any questions?
No.
Okay, and I'm gonna make sure my patient is left in a safe environment. Make sure both of the bed rails are up. Make sure the bed is at its lowest position, and make sure the call light is within reach. That's it.